Hello guys, a very good morning to all of you. Today I will be talking about impacted tooth. The term impacted tooth means submerged within the bone or soft tissue crypt. Occurs when the erupting force of the tooth is not sufficient to cause resorption of the overlying alveolar ridge or due to an obstacle such as a tooth. Depending on the orientation of the third molar to the second molar, impaction can be classified into four types: mesioangular, horizontal, vertical, and distoangular. Mesioangular impaction has highest frequency of occurrence and is the easiest to extract, and distoangular is the most difficult one. The order of highest to lowest in the frequency of occurrence of impacted tooth is mandibular third molar, followed by maxillary third molar, followed by maxillary canine, and lastly by mandibular second molar. Now, there are certain signs and symptoms that are associated with the impaction of third molars. There is pain and swelling over the area of impaction. There is inability to open the mouth when it is linked with the third molar. There is infection and inflammation of the soft tissues around the impacted tooth. If the swelling is too large, then it can cause paresthesia, that is tingling and numbness of the jaws, deviation of the mandible to one side, that is the affected side. When infection is associated with a chronic irreversible pulpitis, there may be exacerbation of pus with halitosis and cellulitis. Investigation includes complete blood hemogram including total leukocyte count, differential leukocyte count, platelet count, and hemoglobin percentage. Radiographs or X-ray include periapical IOPR, occlusal view, and orthophantomogram. In order to assess the difficulty of extraction of impacted tooth, there is the assessment called the Warfae assessment. Warfae stands for Winter's lines, height of mandible, angulation of third molar, root development, follicle, and path of exit. Now, Winter's lines. There are three lines which are grouped together as the Winter's lines. White line corresponds to the occlusal plane, indicates the level of difference between the second and third molar. Amber line indicates the margin of alveolar bone enclosing the tooth. Red line, a line drawn from the amber line to the point of application of the elevator. An increase in 1 mm of the length increases the difficulty 3 times. Winter's classification. Position A. Highest position of the tooth is on a level or above the occlusal plane. Position B. Highest position is below the occlusal plane but above the cervical level of third molar. Position C. Highest position is below the cervical level of third molar. Winter's classification also includes the types of impaction, and these are graded as different degrees: vertical 0 degree, mesioangular 1 degree, distoangular 2 degree, and horizontal 2 degree. Height of mandible 1 to 30 mm 0 degree, 31 to 34 mm 1 degree, and 35 to 39 mm 2 degree. Now the angulation of third molar to the long axis of the second molar. 1 to 59 degree 0, 0, 6 to 69 degree 1, 70 to 79 degree 2, 80 to 89 degree 3, and above 90 degree it is 4. Root shape and development. Favorable curvature is 1, unfavorable curvature is 2, complex anatomy is 3. Root formation 1/3 complete equal to 2, 1/3 to 2/3 complete equal to 1, and 2/3 complete equal to 3. Follicles around the impacted tooth. Normal equal to 0, impaction relieved equal to 1, possibly enlarged equal to 2, and enlarged equal to 3. Path of exit, space available equal to 0, distal cusp covered equal to 1, mesial cusp covered equal to 2, both covered equal to 3. Pedersen classification is the distance between the distal surface of second molar to the anterior border of the ramus. Class 1, sufficient space is equal to the mesiodistal width of the third molar. Class 2, insufficient space that is, the space is less than the mesiodistal width of the third molar. Class 3 is third molar is impacted within the ramus. Difficulty index. The scores of warfare assessment are added up together to produce the difficulty index. Very difficult is 7 to 10, that is the total score. Moderately difficult equal to 5 to 6 and slightly difficult equal to 3 to 4. The relationship of the inferior alveolar nerve canal with the roots of the third molar has been given by the Howe and Python criteria from the radiograph. The canal may pass above or below the level of third molar apex and lie in the line with the root or buccal or lingual to it. Occasionally, the neurovascular contents of the canal may groove or perforate the root or stretch the apex of the root. If the canal is located near the apex or upper middle or third of the root, the nerve will obviously lie buccal to the root. When the canal is close to the apex, it may be directly beneath the root or buccal or lingual to it. The condensed bone forming the roof or floor of the canal are represented on the radiograph as parallel bones of the radiograph bands. This was all about impacted tooth. In the next part, we will discuss about surgical techniques for extraction of lower third molars. Thank you guys.